Okay, now this is video number 2 for the alterations in the endocrine system content. The first one talked about diabetes insipidus, so I just wanted to review that really quick with what would a head-to-toe assessment for a diabetes insipidus patient look like. So neurologically, I think they might be confused. If their sodium is high, as you know, if someone's sodium is high or if their sodium is low, then confusion can always set in. Respiratory. If they have low blood volume and they have low blood pressure, I am thinking that they could have higher respirations. Think about that. Put that in your mind as to why you would think that their respirations might be higher. I think it has to do with oxygenation. Cardiovascularly, again, you have low blood pressure, and sometimes with low blood pressure and hyponatremia or hypernatremia, this is a weird situation because they're actually hypernatremic. You would quite often have tachycardia. You might even have a little bit of a fever from it. GI. These people are intensely thirsty, so they're not probably going to have a very good appetite. So what kinds of foods do you think would be good for them? I'm going to go with things that are cold, things that don't make you even more thirsty. So yes, you want to stay away from anything, any broths, anything like that that would have a lot of sodium, canned goods. So anything fresh, anything cold, and you want to make sure they have enough protein in their system. What's going on GU? Again, they have intense amounts of output. Urine like you would not believe. Again, imagine peeing out 10 2-liter bottles in one day. That is an awful lot of urine. So have you put in a Foley? And if you've put in a Foley, what are the needs you have to provide? We have to keep that thing as clean as we can. We want to keep their skin intact. We want to make sure that it fits well, that there's no drainage from it. Again, it's all about sterility and care of the Foley. And then the rest of their skin on the body. It's dry, it's tenting. When skin gets dry and tented, it has a tendency to break open. So what are we going to do to maintain their skin integrity? How about some barrier creams? We don't want to be scrubbing it a lot, but we certainly want to be moisturizing them and making them as comfortable as possible. And then musculoskeletally. Again, you have confusion from the neurological issues of the sodium. So this patient is confused. They're very, very sick. They're very weak. They're very high risk for falling. So what are we going to do to keep them safe? Whenever you have a disease process, always go through it from head to toe and write down what you think you're going to see and what you're going to do about all of those things that you see. So now let's move on to syndrome of inappropriate antidiuretic hormone, otherwise known as SIADH. I have seen one patient with this disorder, and it really is very, very interesting. I really hate to say when somebody's sick that it's cool, but when someone has either diabetes insipidus or SIADH, they are very, very sick. Usually, I don't want to say they won't recover from this because they will, but whatever caused it, they are probably pretty close to the end of their life. So try and remember that when you're thinking about this disease processes. But in this case, they have too much antidiuretic hormone. So what do you think is going to happen to the urine in this situation? It is going to become hard for them to urinate. The kidneys are not going to concentrate the urine, or I should say the urine is going to be so concentrated that it's not going to be dilute because all the fluid's going to stay in the vascular bed. And so these people have the opposite of what goes on with diabetes insipidus. The kidneys can't dilute the urine. It holds onto the water, but it does release all the solutes like the potassium and the sodium. So all of those things we know about electrolytes and water following salt doesn't really happen with these two disorders because there's so much else going on. The causes is usually cancers of some sort. Sometimes a surgery, a head injury, a stroke. Again, these patients are really, really sick. What are you going to find? You're going to find retention of fluid, so they're going to have a high amount of edema, intense weight gain. Sometimes with these patients, they have so much edema that their skin actually weeps. Their urine is extremely concentrated, so it's dark brown, has a funny smell, and their blood, they're hyponatremic. But again, they're thirsty too. Again, these disorders are really bizarre. They have a severe electrolyte imbalance because when one electrolyte goes crazy, so do the rest. They have a lot of nausea and vomiting. They might have muscle twitching, severe changes in level of consciousness. The way they diagnose it is through electrolytes. They'll be hyponatremic. Sodium is very low in the serum, in the blood, but the sodium is very high in the urine. Urine-specific gravity, it's like the Dead Sea as far as that you could float in their urine because of the high salt content. What are we going to do? First of all, we want to eliminate the underlying cause, if it's possible to eliminate the underlying cause, because like I said, these people usually have a pretty bad outcome. It's usually cancer or something like that. We want to restrict their fluids, and this is really hard because they're thirsty. And the thirst is, again, it's a weird anomaly because of the disorder. We're going to put them on a lot of diuretics, Lasix, all kinds of different things. We're going to be giving them a hypertonic solution so that we can get the fluid into the vessels and then get the kidneys working. And then we're going to give them a drug probably called democycline that will help. We want to keep the serum levels as close to normal as we can, the sodium levels. And then if we have to, we go on the higher edge to try and get the fluids out. So again, nursing diagnosis, what are we looking for? We're looking for excess, you're going to see excess fluid volume, ineffective health maintenance is another one, fatigue, risk for injury, risk for fall. These people are very, very sick. They're very confused. So a lot of the nursing diagnosis that you would use for diabetes insipidus would be the same, but maybe for a different reason. And we're going to do some nursing interventions, strict I&O, maintain a fluid restriction, and this is really hard because they want to drink. We're going to provide a lot of mouth care. This is a good time to have like hard candies, ice chips instead of drinking water, anything that they can keep in their mouth to keep their mouth nice and moist. We're going to watch their vital signs, watch for level of consciousness. These people can go into seizures pretty easily because of the low sodium. They can have muscle twitching, muscle cramping, and we're going to educate the patient about all of these along with the disease process that is bringing it on and what we can do for them. So, if we appropriately provide treatment, there will be no sign of fluid overload. Their weight and their vital signs will stabilize. There'll be no sign of electrolyte balance. We want to get their serum sodium back up to normal. And the patient will understand the disease and report the signs and symptoms. So I want to go back to our slide where we did a head-to-toe for diabetes insipidus. And let's see how we can compare it to what goes on with syndrome of inappropriate antidiuretic hormone. So if I add here, yes, this patient's going to be confused, but it's going to be from low sodium. Again, any disruption in the sodium can make a difference. What's going on with their respiratory system? Well, these people are in fluid overload. So I'm thinking we're going to hear some crackles in their lungs. They might be short of breath from fluid overload. Cardiovascularly, okay, we could have some big problems here. Their blood pressure could be high. It could also be low because the fluid is staying in the extracellular fluid. It's not coming into the vascular bed to be reduced. It's a really bad thing, but they could have high blood pressure. And they could be tachycardic again because their lungs aren't oxygenating well because of the fluid. All right, they are intensely thirsty. Again, with appetites, we're going to have to be really careful to make sure the fluid restriction is maintained. Hard candies are great. Popsicles. Yes, popsicles have fluid, but I spelled popsicle wrong, didn't I? But they still will eliminate some of that intense thirst. These guys are going to have limited output, and they also are going to have concentrated urine. It's going to be dark, might even be thick like syrup. And their skin will be stretched. Their skin could be weeping. Again, think of overfilling a water balloon, and that's what you're going to see. And just like our patients with diabetes insipidus, these people are really, really sick. And we got to do whatever we can to make them feel better and keep them safe. That is our job. So that's syndrome of inappropriate antidiuretic hormone. The next thing that we're going to talk about is alterations in thyroid function, and that will be in the next video. Thanks a lot.